This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about creating transparency in the beauty space. I'm McKenzie Westmore.
And I'm Dr. Paul Nassif. And today, we get to talk about a very interesting topic, facial feminization.
Yeah.
And my friend for many years, Dr. Clevens, who practices, he's a facial plastic surgeon, just like I am. And, you know, there's a few of us, not me specifically, except for maybe a nose or a facelift, but that really focus on the type of surgery in regards to facial feminization. And again, it's really specific techniques. And it's very interesting when a patient comes in and they're transitioning and now how that whole process goes.
Yeah.
Like compared to the old days, you know, when it was a lot harder and you have to go through a lot of psychological testing and all kinds of things. And maybe it's still the same. I don't know. Mm-hmm. But everyone, please welcome Dr. Ross Clevens. How you doing, buddy? I haven't seen you since, you know.
Hi.
Wait a minute, what meeting? Was it Miami or where did we, because we talked about, I know where it was. It was in Boca Raton, Florida.
Right, at the Boca Raton Hotel and Club back in the spring.
Yeah, and that's when I found out that you guys were married, Tara.
That is true. We are, Tara and I are happily married.
You know, and everyone's probably going, this Tara. Well, it's interesting. So we have all these medical meetings for many years, and it will go to, and we lecture and teach, and we were just at a meeting. And I saw Tara. Tara is someone I've known for years, and she's in different businesses of the plastic surgery med space.
Right.
And now she's in a very, wonderful, I don't want to use the word advertising, but media where we use artificial intelligence and stuff. And it was interesting. I saw them together. I said, I kind of was wondering. And then I found out they're married, and I've known her, for so many years. I probably have known her longer than you. So anyway,
true.
One thing that I didn't know about, and I didn't know that you do that type of surgery. I know, we have our buddies in Boston. We both know, and actually, I think you're even doing something.
Yep.
Business stuff.
Jeff Spiegel.
Yeah. And I just guessed that, by the way, because I know you and I were talking, and then he and I were talking. That's a whole nother conversation. But besides being an incredible surgeon, you're also, an incredible kind of all-around guy. But I didn't know that you were into facial feminization until my CEO, Alice, told me.
Right.
All these years, I didn't know that.
So I've been in practice in Melbourne, Florida for 25 years now. And a few years ago, we started to see some patients who were undergoing transition, a lot of male to female trans patients who were interested in facial feminization surgery. So really, in many ways, facial feminization requires specific techniques, but in many ways, it's an extension of traditional facial plastic surgery.
Mm-hmm.
When we talk about that, because I know you did your training at Michigan, that's when I remember you. But I think, were you and I the same year?
You actually came to interview for Shan Baker's fellowship while I was the fellow.
So you were two, okay. Yeah,
so I gave you a tour.
Years.
Yeah, I gave you a tour while you were visiting Ann Arbor.
Isn't that funny? That just shows. So I've known you for that long. And now look at us. We're kind of, well, actually, I'm getting a lot more gray than you are.
But
I don't know about that.
So, what's interesting, what I want to do briefly first is describe some of the procedures, but the ones I'm going to focus on, because they already know, we've already talked about, since I do a lot of nose, facelifts, that's standard for feminization. But in general, besides that, from the eyebrows to the chin to the thyroid cartilage, can you tell us some of the main features of these procedures?
Yeah, that's exactly what I want to know, the main features and what is the most difficult of those main features to do.
Well, I'd say a couple of things. As you know, Paul, in facial plastic surgery, aesthetic surgery, there are certain characteristics of the ideal male face and certain characteristics of the ideal female face. The shape of the nose, the shape of the brows, the shape of the lips and the jaw. So in performing facial feminization surgery, we're really creating ideal female aesthetic facial proportions in the trans face. And studies have shown that there are really three areas that are of key defining characteristics. And those are the brow, the nose, and the lips. So those are oftentimes key areas that we would focus upon in facial feminization surgery. So the male brow is traditionally straight and horizontal and lower, whereas the female brow tends to be a little higher, a little more arched laterally, as well as the bony rim here. So when we operate upon the upper third of the face, oftentimes we're shaving down the brow bone, we're advancing the hairline down, and then we're also changing the shape of the brows, trying to create a more feminine as well as more youthful shape and contour, both to the soft tissues and to the bone of the upper third of the face. Of course, Paul, you do a lot of rhinoplasty, and I'm sure when you're performing rhinoplasty surgery in a male patient versus a female patient, you have in your mind different aesthetic ideals you're trying to achieve. The shape of the tip, the rotation of the tip, the shape of the bridge. So in performing facial feminization or gender confirmation rhinoplasty, we're creating those female aesthetic ideals in the trans patient in facial feminization surgery.
Do you also have to work on the jawline, the Adam's apple?
Very much so. So a common procedure, in fact, I did one yesterday.
Wow.
The Adam's apple is a dead giveaway in the trans patient. So there are techniques where we can shave down that Adam's apple, the thyroid cartilage, and create a smoother contour and profile to the neck. And that, as you said, McKenzie, is really a dead giveaway and a significant area of concern for many of our gender confirmation surgery patients.
Wait, can I just ask, because I've got two professionals here right now, why do men have an Adam's apple and why don't women? Maybe I'm asking a stupid question, but it just crossed my mind. I was like, I need to know the answer to this.
Well, gee whiz. I believe that as the testosterone surge occurs during puberty, that cartilage is sensitive to the testosterone, the male sex hormone, and there's growth or overgrowth of that cartilage. How does that sound, Paul? Does that sound believable?
You know what? I got to tell you, in all these years, I've never been asked that question.
Are you serious?
And I can't even recall when we were actually going through our genetics. We're going through anatomy, and I'm trying to say to myself, what the heck? But it sounds so beautiful what Ross says, because, cartilage, usually there's a lot of bone formation that is different. Bone formation and soft tissue. But thinking about it, the cartilage, like in the nose, usually is wider, thicker.
So it's cartilage.
And this, again, is Dr. Clevens mentioned, is cartilage. And there's the little piece that comes out hornier, which is different than women. It calls to the shape. Again, remember, this is all bone, the shape of the jaw, especially the width of the mandible. But that's such a darn good question. Yeah, I don't think I would have come up with, which it sounds like it's probably about right. This whole
I like
thing
that
with
answer.
testosterone. That's a great
It
answer.
works for me.
Let's Google that.
Yeah, let's Google it.
Not.
But I'll take it. For now, I'll take it. So I'm curious, Dr. Clevens, what is the most difficult? Like, what has been the hardest surgery for you to really kind of work with, the longest, when you are dealing with that feminization?
Well, that's a great question, McKenzie. Many of these facial feminization, gender confirmation surgery patients will have the whole ball of wax, the whole transformation performed in a single procedure. So it's a That's a long case where we're addressing the brow, the nose, the chin. As Paul said, oftentimes we're putting facelift surgery, deep plane facelift surgery as part of the gender confirmation surgery. So it's really working with that patient's anatomy and really trying to create the face that they feel that they should have been born with.
Great point.
Right. So the patients feel that they were not only were they not born in the body that they feel that they should have had, but they were not born with the face that they should have had or deserved to have. And that's what we're trying to accomplish in gender confirmation surgery. Exactly that. We're trying to confirm their gender as part of facial feminization or gender confirmation surgery.
Number one, what is the process before you do this nowadays in regards to any workups beforehand? Are there the holes? You have already, I assume, when they come to you, they've already been there, done that, but our own hormonal treatment, HRT, everything, So is that correct, number one? And two, a young person comes in who wants the whole kitty caboodle. What is your age and why?
Yeah.
But you'll do that on the earliest.
The minimum age.
So those are a couple of great questions. So all of the patients that we see have been undergoing this transformation for 3 to 5 years, at least. They've always felt uncomfortable in their face and their bodies, but for the last 3 to 5 years at least, they've been undergoing counseling, they've been undergoing analysis, they've been undergoing hormone replacement therapy. So when we first see them, their skin texture has changed, their hair pattern has changed, so they're well along the route. In terms of surgery, oftentimes facial feminization or gender confirmation surgeries may be one of the first procedures that they have. There's also, I don't perform this, but we do in our practice, is what's called top surgery. So male to female patients transitioning will have breast surgery. So facial feminization is often the first stop along their surgical journey. As far as age range, interestingly today I saw 5 transgender patients in follow-up, and they ranged from 28 to 72 among the patients I just saw today in my office.
Wow.
We tend not to see patients much younger than, let's say, their 20s, because again, they've been undergoing counseling, hormone replacement therapy, and so forth, generally for at least 3 to 5 years before we see them.
So pretty much really in the early 20s, if you had to pick some, if we say, but again, they've already been along that route.
Yeah.
Okay, so let me ask you this. I'm going to ask you, because, you and I always get questions, consults, and a little difficult situation. Patient comes in who's 18 years old, now an adult, doesn't need, any permission from the parents. And they come in and say, I want a feminization rhinoplasty, or maybe a bone contour with a coronal and the eyebrow lift. And they're 18, and they really haven't been down that road yet. So they're coming backwards a little bit compared to the normal protocol.
Right.
They're coming first to you before hormone treatment and even before any of the other other workups. What do you do in that situation?
Well, as surgeons, it's incumbent upon us to be responsible. And at least in my experience, in my opinion, surgery is not and generally should not be the first stop along a patient's transformative journey. So in my practice, if I saw an 18-year-old patient who had not been through counseling, who had not been through hormone therapy, we have counselors, social workers, other physicians that we work with. I would make a referral for that patient to investigate this transformation separately before embarking upon surgery.
Got it.
Thank you. I expected that, of course, but that's a great point to say. McKenzie,
Now, you mentioned something that I thought was interesting because I've always known about the forehead, the jaw, the typical areas, but you mentioned the lips.
Yeah.
Now, is that surgically a lip lift that you would perform, or are we talking lip fillers?
Very good question. Oftentimes, a lip lift is an integral portion of facial feminization surgery. You know, the male lip is long, this white upper lip is long, the lips are thinner. The female lips are fuller, more voluptuous, have a shorter distance between the nose and the lip. So a subnasal or bullhorn lip lift is oftentimes a key procedure as part of facial feminization surgery.
Interesting. That part I didn't know.
Now, do you perform, this is a quick little topic, but we'll talk about this because this has to do with aging face surgery at the same time as rhinoplasty. Do you perform open rhinoplasty at the same time as a bullhorn lip lift?
I do perform open rhinoplasty at the same time as the bullhorn lip lift. I've done hundreds of them and not had any surgical complications or problems related to healing. So I routinely perform them together.
And just for anybody listening, with the lip lift, the incision is up in the nose, correct?
Correct. The incision runs underneath the shadow of the nose and is hidden in the crease underneath the nose. That's correct.
Got it. How
Yep.
interesting.
Yeah, because, the thing is the blood supply, from this upper lip incision usually is not affected in generally by the blood supply that's, attacking the nose. But the interesting thing is sometimes when we're doing this, and this is a little bit more scary, but I've done this before, we'll do, because the cuts are around the nostrils, but we'll also take some of the size, the width of the nostrils called anal base reduction.
Right.
At the same time as a rhinoplasty, at the same time as a lip lift. A little bit scary because you're worried about the blood supply
Yeah.
right at the base of the nose, where the distance between the two incisions,
Right.
and that blood supply really is coming from inside out.
It requires a little bit of surgical planning and creativity in terms of creating your incisions, but in my experience, they can be safely and routinely performed together.
Now, I got a question, and this couldn't be for both of you. Maybe it's stupid. I don't know. I just
Nothing is
ask
stupid.
things. I just ask them. Dr. Nassif knows. I just throw it out there.
You got to do.
But I got to know, do you ever see the opposite? Do you ever have women coming in that want to be more masculine because they are also transitioning?
Oh, sure.
Do you ever see surgeries where, and how do you approach that?
Oh, sure. We see patients that are transitioning from male to female, as well as patients that are transitioning from female to male. And I would go back to what I earlier stated. There are certain aesthetic proportions and certain aesthetic ideals that define the male face, or the ideal male face and the ideal female face. So again, if a patient is transitioning from female to male, we might look at those characteristics and surgically transpose male characteristics onto that female-born face.
Now, how would you go about that? I'm so curious because when you're
good question.
when you're talking about a feminine face, you've got to build out a jaw, you've got to make a heavier brow, so and an Adam's apple. So I'm just curious, how would you go about that?
There are surgical implants that can be used to augment the chin, that can be used to augment the jaw. With a rhinoplasty, you could build up the bridge of the nose. I'm sure Paul has some thoughts on this to create a more masculine appearance to the nose. The eyebrow shape can be changed. The brows can be dropped or reshaped so as to be more horizontal. So sure, those.
And would you build out an Adam's apple too?
I have not had experience building out an Adam's apple, but that's actually a great idea.
Well, there you go.
There we
Run
go.
with it, Dr. Clevens.
I learned something new today. We're going to have to come up with an Adam's apple
I'm going to keep an eye on
implant.
you now, and I'm going to see if you do it.
There
I
we
was
go.
thinking that. Okay, how are you going to actually, take some,
a
some
little implant.
hydroxyapatite or something, which is called calcium. We use different products in McKenzie to try to add on to the Adam's apple, or to sit there and, add on the brow to make it thicker and coming out.
I mean, this is so fascinating to me because I do have friends that have transitioned from male to female. I don't know anybody that's transitioned from female to male, so that's why I was curious on that side. And the surgeries I've seen, they are beautiful. I mean, your work, obviously, it's stunning and it's gorgeous. The friends that I have, they already had a feminine appearance and they knew they were born in the wrong body. So when they underwent surgery, it just made sense and it made them feel better. I am curious, have you ever had a patient that turned around and you did amazing, beautiful work, but they realized maybe this was not the direction they wanted to go in?
We have had patients with gender fluidity, patients on whom I have performed facial feminization surgery, and then at some point, a few years down the line, they transition back to a male gender identity. Uncommon, but I have seen that.
And do you perform another surgery then? Have you had that?
I have not had the occasion where I've reoperated upon a male to female, back to male patient, but I have had patients that have transitioned their identity.
Interesting. Very interesting. So I guess what's something we do have on our list. So far, I don't think we've asked anything on our list. But what is the most memorable surgery that you can think back on that really warms your heart, makes you happy?
I have so many patients that have truly been so grateful for my participating in their transition. It's a group of patient population that's generally very pleased with their surgery, but they're not only pleased with their surgery like so many patients are, but they're pleased that we've helped them in their gender identity transition. So it's a very grateful, pleased group of patients in my experience.
I love that. I mean, because that's what I've seen. Like I said, the friends that I've seen go through it, it is nothing but happiness, joy, tears of joy, because they are finally living their life the way they always felt they should be. Yeah. So thank you, Dr. Clevens, for helping so many through that.
Oh, of course.
I'm so curious, if somebody is doing the whole kit and caboodle, how long is that?
If the patient's doing the whole kit and caboodle, oftentimes that can be a 6 to 8 hour surgery, perhaps longer.
Wow.
So it's a major outpatient surgical procedure. But again, patients recover quickly from facial surgery, and even with a complete facial feminization transformation, most patients will be back to work in 10 to 14 days, 2 weeks.
Wow.
With some hair and makeup, yeah.
That's just fantastic.
Okay, I was going to say, you're in Melbourne, where most of these patients live in Miami.
So Melbourne, Florida is located due east of Orlando. So we're basically the beach town of Orlando. So we see a lot of patients from Orlando, from Central Florida. We'll see patients from points north, Daytona Beach, New Smyrna Beach, as well as some patients from, further south, Fort Lauderdale, Boca Raton, that area. As well as from Melbourne itself, but we draw from more of the metropolitan areas closer to us.
And Melbourne is on the water?
Melbourne is directly along the east coast of Florida. We have Kennedy Space Center, SpaceX, all the space shots go up from Melbourne, Florida, from our town.
Very cool.
I just had a total brain fart, and I'm hearing Melbourne going, wait a second, what time is it there?
Melbourne, Florida, not Melbourne, Australia.
So I was like, I'm so sorry. So I got to ask, what are some of the biggest lessons that you've learned throughout your career that maybe you wish you'd known before?
Good question.
Some of the biggest lessons I've learned. Every patient is different. Every patient is unique. Every patient brings a unique set of experiences and worldviews to the table. And we're trying to help them along their journey in life by addressing some things that might concern them or make them feel better in their own skin and feel better with themselves.
Now, I don't know if we brought it up earlier, but I don't know if we really got a solid answer on this. So I apologize if we're repeating ourselves here. Do you ask every patient to go through any sort of psychological process before going through surgery, or is it just we're going through with this and we're doing it?
No. Every patient that I see in my practice has already gone through psychological, social. They've all gone through
Got
that.
it.
So my office is not their first step on their journey.
Got it. Now, but if anybody has not gone through that, do you require them then to go through any?
We do. If a patient has not undergone therapy and counseling regarding their gender identity, we work with a team of practitioners that we would refer them to.
That's fantastic. And what would you say is the best advice that you have for patients thinking about plastic surgery and feminization?
Well, all of the patients that we see for facial feminization surgery are patients that have been thinking about this surgery for a long time. They've known oftentimes from a very young age that they're just not living in the right body. And when they come to us for surgery, they are determined, and it is a well thought out decision. It is not a seat of the pants sort of decision for the patients in our practice.
So I do have one more question. Sorry, Dr. Nassif, I have so many questions.
Oh, yeah. No, please.
So
have fun.
Because I love this. Because my friends have all my friends that have gone through this surgery, most of them have been 30s, 40s, even I would say almost 50s, which breaks my heart because I feel that so many times I hear from my friends they did not start living their life until middle age. And that's so sad to me because I feel everybody deserves to live their life from the get-go. I'm just curious, in your practice, what is the average age? I know we said a span, but what is the average age that you see?
The average age patient that we see in our practice is in their 30s and 40s.
So it's the same. Yeah.
But we've seen patients as old as 72 making these life changes, and as I said, some patients in their 20s. And as you said, imagine going to 70 years, living a full life, 70 years of age, and in the wrong body, the wrong face, the wrong identity. So it's an honor to be a part of those patients' journeys.
I love that. I love what you do.
I love what I do as well.
Yeah, I mean, let's listen. It's all, again, what we do, the surgery is the fun part of it. Ross, I will tell you that getting this information out, especially kind of more of a 36,000 feet overview while this is done, was fantastic. Because, folks want to know.
Yeah.
My last question for you is, if you're going to do a facelift on these patients, are you doing anything different than a traditional, I don't know what type of facelift do you do first?
I perform a deep plane facelift.
Okay, just like I do. And that's why Shan, though, had that dual or that dual vector.
Triplanar facelift.
Triplanar. I remember that from the lectures. I remember everything. So we're talking about, by the way, the guy he trained with was very good friends with the gentleman who got me interested in facial plastic surgery, Carl Eisbach, University of New Mexico.
That's right.
So they were good friends and both used to run.
Yep.
And that's why I met Shan Baker, who I think he's retired now, right?
Shan is retired. Yep.
Yeah. And it's interesting. The reason why I remember Shan is from that one lecture, different type of a face. Two, I remember Shan from, of course, his incredible reconstruction books. Yeah. 3, which I do day in and day out, is, even though it's popularized more from Dr. Tasman, when he was talking about the diced cartilage glue grafts that I use in the nose, fiber glue and diced cartilage. And I've now done thousands. And so, it's interesting. So the Dr. Clevens Tramwood, wonderful. So, kudos to him. I'm glad he's enjoying his retirement and doing stuff like that. But So we want to thank you. Now, the next step on this would be, if our folks listening,
Yep.
tell us about your website and your social handles.
How do they reach you?
How do they reach you?
So we're located in Melbourne, Florida. The website's www.drclevens, drclevens.com. You can find us on Instagram at Clevens Face and Body Specialist or at Ross Clevens, and on Facebook as well.
Fantastic. Thank you so much for joining us and
was
enlightening
fun.
me and everybody listening and watching. I know will.
Yeah.
What about you? How do we find you, Ms. McKenzie?
I am at M Westmore, Instagram, Facebook. Twitter's Mackenzie Westmore, no E. I joined Threads. I don't know if you have, Dr. Nassif, but
I have not yet.
I have not.
No, I'm still learning all these. I do know that I'm on TikTok now.
yes, I have TikTok also.
I've seen some of those on yours. And mine's Dr. Paul Nassif, Dr. Paul Nassif. Nassif, Nassif Medical or Nassif Skincare. But
Yes.
Dr. Clevens, it was great seeing you, my friend. I'm sure I'll be seeing you
Yes.
at, when is our next meeting? Is it in Vegas or where? Or
I might see you in Miami in November. If not Miami in November, Vegas in November. At our
Yeah.
You
I'll
guys
be-
better come see me. I'm in
Yep.
Vegas now, so I want to meet you, Dr.
Well-
Clevens.
Be
yeah,
my
well, we'll
pleasure.
both be
I'd
in
love to.
Vegas, our American
Yep.
Academy Facial Plastic meeting. You're going to go. I'm going to be going to August to San Diego instead of the Global Aesthetics. And as I do that meeting,
So
I run
West
the
Coast
nose
meeting.
portion of it. So thank you very much, my friend.
Thank you.
Please give Tara a love.
I will.
And,
Thank you so much for having me.
Thank you all for everyone listening to the Mystified Beauty Family. Thank you all for listening to this incredible podcast of Mystified Beauty, which is, of course, on YouTube. And where else can we find besides this on Instagram and stuff? Where can we? I know we have our social.
Anywhere you can catch us, anywhere you like to listen to your podcasts. Maybe it's Spotify, Apple, anywhere you get your podcasts.
You just type into Mystified Beauty.
Yes.
Okay, good.
And
Especially
be sure to subscribe, like.
Oh yeah, you have to subscribe and like this because it's fun stuff. We have great talk.
It is. We do.
Everybody have a great afternoon.
Thank you.
Bye, everybody. Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. If you have any questions for future episodes, please don't hesitate to reach out to us on Instagram at DemystifyBeauty or email us at demystifybeauty@gmail.com. And don't forget to subscribe, rate, and review the show. See you next time.